Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Diseases we thought were gone, mostly gone or under control by vaccinations, are making a comeback. Over the past decade, vaccine-preventable diseases have gained a new foothold, posing a threat to our country's population health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we talk about the effects of the anti-vaccination movement. Stay with us. We'll be right back. Welcome back. Though vaccination has led to a dramatic drop in cases of certain contagious diseases in this country, vaccine-preventable infections are still a threat to us and our communities. Joining us this morning is Dr. Greg Holzman and Stacy Anderson from the Montana Department of Public Health and Human Services. Thank you both for being with us.
Thank you.
Thank you.
I'm going to start with you, Dr. Holzman. Can you tell our viewers about your credentials? What kind of a physician are you?
Oh, I hope a good one, but I'll add in what credentials I have is I've actually done 2 residencies. I'm boarded in 2 areas. One is in family medicine, and one is in preventive medicine, which is a lot of public health, and got my master's in public health through that residency program also.
Excellent. How long have you been in Montana?
This time around, it's just about 3 years.
Okay.
My first job out of residency, from my family medicine residency, was actually on the Blackfeet Indian Reservation. That was the first time I'd ever touched foot in Montana.
Excellent. Thank you. How about you, Stacy? Talk about your background.
So I have a background in microbiology, which is contagious disease and the study of those diseases. And then I have a master's in public health as well from Westminster College in Utah. And I've been in this position for about 7 years now.
Excellent. All right, now I'm going to switch back to you and ask you to talk about vaccinations and why are they so important?
Yeah, a lot of times when I talk about this, I like to talk about the history because it's just so amazing when you look at this. And I can give you a lot of numbers. Let's use measles as an example. If you look at measles, the number of cases in the United States before the measles vaccine was about 4 million a year. And then the measles vaccine came around in 1963. Or if you look worldwide, it was estimated that there was about 2.6 million deaths a year from measles prior to that vaccine. Sadly, that vaccine has not gotten all around the world, and we haven't gotten the immunizations as well as we want. But the deaths from measles has decreased quite a bit, and it's down at 80 to 90,000 a year. So still a lot, but it kind of lets us also here in the United States, where we rarely see measles cases, to understand that this is a serious disease. And I could give those kind of statistics for all sorts of different diseases and what a difference that vaccines have made in that. What I would say is, as seeing the decrease that has happened, I often like to tell stories along with it because the numbers sometimes get hard to understand when you're talking these kind of things. And I think about oftentimes my grandparents who were born 1890, my grandmother was born, and my grandfather was born, and a grandfather and grandmother on the other side in 1908 and 1905. Their average life expectancy at that time was 47 years. That was at the turn of last century, going into the 20th century. By the time we got to 2000, the average life expectancy in the United States was 78.1 years. You have this huge increase, and you think about, well, that's because all these things that happen in medicine. We got antibiotics, we could do better surgeries, we have insulin now that wasn't around beforehand. But actually, when you look at the data and everything, about 25 of those years are due to public health. And the CDC put out this great, CDC is Centers for Disease Control and Prevention, put out this great tribute at the end of last century called the 10 Greatest Public Health Interventions in the last century, and that had the effect on that. And vaccines is one of those. It's a big one in there. There's things from workforce, decreased workforce injuries and deaths, and the numbers are very inspiring to see what a difference that made. Vaccines are probably two things. One is the control of infectious disease, so that we got much better at trying to decrease infections, like with refrigeration and just proper hand washing, pasteurization, how many deaths happen from outbreaks from unpasteurized milk prior to that, these type of things going on. And then to get the immune system, to get your own body to fight a disease before you ever get exposed to it. And that's where we see some great changes with vaccines. And you see things where you see numbers of measles cases decreased by 99%. Or even something in my lifetime has been the Haemophilus influenza vaccination that has gone down a 99% of decrease in those infections. Or some diseases that we don't see anymore at all in the world, like smallpox, or even in the United States, like polio, and hopefully getting close to eradicating that in the world, but still struggling with a few countries where it shows up.
Yeah.
So made a huge difference. And I could go on and on that. Yeah.
That is amazing.
Yeah.
Well, let's switch to Stacy. And Stacy, can you talk about how vaccines change the landscape for communicable diseases in Montana?
Sure. So a good example to kind of take from what Dr. Holtzman was saying is looking at mumps. Mumps is one of those communicable diseases that is currently protected by the MMR vaccine. Measles is one of the other components. Mumps is generally sort of considered a child, or was considered a childhood disease. It's usually pretty self-limiting in that you recover fairly easily, but can have some side effects and some consequences, including things like deafness and an inflammation of the brain. Very rare, but it can happen. Prior to the introduction or the recommendation to give that dose of MMR against mumps, we would see hundreds and hundreds of cases in Montana. And then within the first few years after that first dose was recommended, the number of cases dramatically fell. And then once the recommendation was given to add a second dose of MMR for all kids, it even fell even smaller. We have very few cases since then, pretty much sporadic activity. Every once in a while you'll see an uptick of these things, but generally speaking, it's had a significant impact on the number of cases that we've seen in Montana in the intervening years. Another example that Dr. Holtzman mentioned was Haemophilus influenzae. This is another bacterial disease that affects babies. Since the introduction of that vaccine, we've seen very, very few cases. So it's been a positive impact.
Oh, that's wonderful. Great. Well, we need to pause here and take a quick break. But coming up next, how did the anti-vaccination movement start? And are there really risks associated with the MMR vaccine? We'll talk about that and much more right after these messages. Stay with us. Welcome back. In the late 1990s, a study linked childhood vaccinations to autism. Even though an investigation into the study proved the findings wrong, and even though the doctor who led the study had his license revoked for serious professional misconduct, the study planted seeds of fear and set off an anti-vaccination movement. Dr. Holtzman and Stacy Anderson from the Montana Department of Public Health and Human Services are still with us. So, we're back. I'm going to go to you, Dr. Holtzman. Let's talk about that anti-vaccination movement. If vaccinations are so effective, why do people resist getting them?
Yeah, it's interesting. Since the first vaccine came about, which is actually 1797, was when the smallpox vaccine was first figured out, there's always been an anti-vaccine movement, and that has gone on. We just recently did work on the pandemic flu of 1918, 1919 here in Montana, and during that aside thing, we saw there was a big uproar about smallpox vaccine in Butte, Montana, of a group of people. It went to the Board of Health that said no, they had to get their vaccines, went all the way to the state board that supported them, and the vaccines were given. This issue has already gone all the way to the Supreme Court in 1905 about individual liberties versus community protection, and again, vaccines were supported in that ruling of Jacobson versus Massachusetts. So I think the issue is that's been around. But the point that I think is even more that we need to demystify on the myth is that it's big. Because if you look at a Pew survey that was done in 2017 showed that 88% of Americans believe that vaccines are safe and the benefits highly outweigh the risk to get vaccinated. If we look at our own data in Montana, that we'll see in many of our areas, polio vaccine in kids, up at 88%. We see things, these areas that we see this constant increase in numbers of people getting vaccinated. So there is a small percentage, and there's different reasons that people choose not to get vaccinated or delay vaccinations. But overall, the movement is actually fairly small, and most people see and look at the data to say, this is a good thing.
So let's switch to you, Stacy, and tell us about that Wakefield study from the 1990s. Why did it cause so much concern about the MMR vaccine?
So the issue with the Wakefield study was Dr. Wakefield and some of his co-authors did this study that was looking at young children who were developing signs of autism around the same time that they were given their first dose of the MMR vaccine. And so, in science, one of the things that we have to look at is you can make a connection like that, but can you truly establish what's called a causal relationship, meaning does that event truly cause the outcome? And the problem with that study is that was the conclusion that Wakefield wanted to draw, was that people who were getting MMR vaccine were developing autism. And in fact, that was incorrect. And as you said earlier, that study was eventually revoked. It was reviewed, found to be that some of that data for that study was not only a very small number of individuals, which is very hard to study. You need larger samples, basically, to study something well. But also the data was falsified. And future studies could never reproduce that same result. In fact, future studies have shown that there is no link between the MMR vaccine and the development of autism. And so, as you mentioned, Dr. Wakefield lost his license. The study was pulled back and discredited. And so, I'm here to say there is no link. There is no link between receiving an MMR and the development of autism in the scientific body of knowledge.
So to follow up on that, he was discredited, the study was discredited, yet there are still naysayers who are not vaccinating. So why would that be all these years later?
Well, it did take some time for that study to be discredited. There was quite a period of years between the study's results and the following retraction of the study that resulted in a lot of discussions and with people talking about how these were definitely connected. And of course, if you're a parent and you're seeing this happen, it's scary. You want to know why your child developed these symptoms, and you want to make sure that you educate people around you as to, this is what happened, so I don't want it to happen to you. A lot of that kind of continued on until the study was officially retracted. And then sometimes it's hard to change those modes of thinking all these years later.
And I think there's some other aspects that I would add on to what Stacy talks about here, is the sense that, one, autism is scary, and we're seeing it go up in numbers, and we want to understand why. I think it's sad that we continue to pay so much time in trying to revoke this, kind of going over and over again on that, where we should be putting it towards trying to understand autism and see if there's ways that we could do better on prevention and better treatments of that. The other thing that I think social media probably has an effect too. I mean, we all go to the sources that that we feel best, and so sometimes we will go to a source that, I use the word data, and I use that loosely, that we have the data that supports our pre-held belief, instead of being able to continually to look at the bigger picture and look at the other side's viewpoints to come to those answers.
So we've got about 30 seconds left, and in that time period, can you briefly describe the types of people that shouldn't get vaccinations? Who
Yeah,
are they?
it's very minimal, but there are some times that you'll find a medical reason not to get vaccination. Just to give you an idea, in Montana, about 0.4% of children have a medical reason, and that might be because of an allergy that they have to a component within the vaccine, or it might be that they have a decreased immune system, or reasons that they can't get a specific vaccine. Sometimes it's that they can't get one or two different vaccines, but they can get the others. So talk to your provider and go through that.
We need to pause here and take a quick break, but coming up next, we'll talk more about the impact the anti-vaccination movement is having on public health and what's being done to overcome it. Don't go away. Welcome back. The anti-vaccination movement is playing a big role in the resurgence of diseases that can be prevented by vaccines. Dr. Holzman and Stacy Anderson are still with us. That's great. So I'm going to go to you, Dr. Holzman. We talked about vaccine hesitancy before the break. How do you move forward with messaging to really get more people to immunize?
Yeah, I like that you use the word hesitancy, because sometimes they put them all into this anti-vaccine movement, and a lot of it is hesitancy. And there's a great article in The Atlantic by Julie Beck, and I've stolen from her, but I think she really does it well to categorize us into 4 different types of people. One, she talks about the complacent. We don't see the diseases around us all the time anymore, so we're not always in a hurry. We're not against the vaccine by any means, but it's like, you know, I can't get to the doctors this week to get the flu. I'll get it next week. And, you know, it just gets put off. And so there's that delay and delay and delay. And so we see people miss opportunities to get vaccinated and be up to date with their vaccines, and see this with children too. The other one would be the inaccessible, and I think that happens in some of the areas that this group goes to, where it might be a long drive to get to a provider that can give the vaccine, or the cost and stuff like that. The ACA has helped with that, but the Affordable Care Act. But that's another reason that people might not get vaccines. So we need to encourage them the importance of that, and also give them ways to try to decrease those obstacles. This next person would be the ones that are real contemplated. I mean, they're the ones that have calculated everything. We call them the calculators. They sit down and go, well, we haven't seen polio in this country in a long time, so while there's very, very little risk, I think I will not get my kid vaccinated because everybody else is vaccinated around them. The wrong problem is if too many people start doing that, these diseases are a plane ride away, and then we do have these problems. The last one is the group that's just completely incompetent. They might not trust government, they might not trust doctors, they might not trust the pharmaceutical companies or whatever. Those people are really going to be hard to switch over, and I will still talk with them and give them my information and listen to them with respect when they come in. But I realize the chances that they're going to change over is probably very little, unless sadly one of their children gets the disease, which we highly hope doesn't ever happen. Or the other area is their friends and families around them really convince them, and that does make a difference. People that they have built trust with and hearing it from them. So it's good for people that even believe in vaccines to talk about the importance to those around them.
Mm-hmm. So clearly the need for multiple messaging.
Multiple messaging, yeah. And a lot of listening, respecting what other people have to say too.
Absolutely. So I'm going to turn to Stacy. You both work for the Montana Department of Public Health and Human Services. We know that, and I understand that there is a rather famous individual from Montana who's responsible for a lot of what we see positive about vaccines. So Stacy, tell us about Dr. Maurice Hilleman.
Right, so Dr. Maurice Hilleman actually is a native of Miles City, Montana, which not too many folks know about. You know, when we learn about the history of vaccines, he's not one of the names that usually pops up. But he has contributed to the development as well as the safety and efficacy studies of more than 40 vaccines in his career, and has been credited with saving millions of children's lives. He's done his body of work has been very powerful and very positive for vaccinations. An interesting story about him is that he was one of the folks that worked on the MMR vaccine for measles, mumps, and rubella. His daughter came down with the mumps, And he was a scientist working in a lab. And so he took a swab of his daughter's cheek and then grew up the mumps virus that she was infected with, and used that virus to improve the preparation of the MMR vaccine. And that strain is called the Gerald Lynn strain, and it's still in the vaccine that we use today to protect our children. And to even make it more of an interesting story, years later, his younger daughter was one of the first kiddos that was inoculated using this new preparation of vaccine. And there's an iconic photo out there of the two siblings, helping each other through that process of getting vaccinated. So we credit him with a lot of the positive things that have happened to protect kids against these diseases that were, terrible many, many years ago. So
another example of a Montanan making a big difference in healthcare, right?
Yes.
Let's switch to Dr. Holzman. So really interesting history. But let's talk about the future. What does the future hold for vaccinations for all of us?
Yeah, I'd love to see some more studies and some more vaccines come about, because I think they're huge successes. But we're seeing things with new diseases that come forward. We now have an Ebola vaccine that's going through trials at this point in time, but they're actually using it right now in the Congo with an outbreak that's going on there. Hopefully someday we'll get an HIV vaccine. So there's these infections. We now have therapeutic vaccines. This is a little bit different. So the first vaccine that came out like that was the hepatitis B vaccine. This is a vaccine going at a virus, but we know that virus has a big effect on having things like liver cancer, so trying to prevent that, or HPV, trying to prevent cervical cancer, penile cancer, and other issues there. So we have that aspect coming about. The other thing that we've seen a lot with is some work, and I think Stacy and I would both love to see this, is a universal flu vaccine. So we don't have to try to guess what's coming next year and put the strains in there, but finding an antigen aspect on that we could give once with a booster, and then you'd be covered for flu for the rest of your life. And then the last thing I think is some of the new areas of how do we give those vaccines. We have oral vaccines, we have nasal vaccines, but the newest one that's coming about is what we call microneedles, and it's like a little stamp with the antigens on it, and they just push it on there, and then you pull it back and the antigens stay there, and all of a sudden you start to get a response to that. So that wouldn't be that great not to see your child be screaming and getting those shots and being able to go that way. So that would be awesome.
I will look forward to that day for sure. Thank you both so much for being with us today. And thank you for watching. Be sure to join us again next week. Until then, stay fit, stay well, and stay healthy for life. With Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.